Good morning, everyone. Thank you so much for joining us on today's webinar, part of the North Sound ACH's weekly webinar series. My name is Heather McGinnis, and I am a project manager here at the ACH, and I'm glad you could join us. So today's webinar is going to be focused on Dentistlink and talking about how we can use this tool for connecting patients and clients to oral health care in our region. So this webinar is being recorded, just so you are aware, and that is so we can share it with folks who weren't able to join us today. And that recording will be found on the partner portal later and will also be emailed out to you who are joining us right now so that you can share it with your colleagues if you would like. Right. Great. So all of your lines are muted to reduce background noise. So what we would like to do is that if you have any questions, please use the Zoom chat box, which you should see a little chat icon in the menu of options there in Zoom. And you can type it either to everyone or you can select to send to admin privately if you would prefer to send your question that way. We will be capturing questions throughout the webinar during the presentation about Dentistlink so that we will have a Q&A at the end. So keep sending those in as we go, and you will also have an opportunity to do that once we get to the end of the webinar. As I mentioned, this is being recorded, so it will be posted in the partner portal under documents. It will be a link to a YouTube video, and then we will also send that out along with the slides and any other resources that are referenced during the webinar via email to participants. But we want to make sure that that's available for you so you can listen to it later or share with any of your colleagues or partners you think would be interested. All right. So before we dive in, we would like to do a land acknowledgement. This is something that the ACH is focusing on doing in all of our meetings. And so this is ours. We begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. If you want to learn more about the indigenous land where you are today, you can visit that website there. It's nativeland.ca. to learn more about the land where you are and learn more about how you can create your own land acknowledgement. All right, so let's talk about today's webinar. So we will introduce in just a moment when we turn it over to her, Svea Strom from the Arcora Foundation, and Svea is going to be presenting the webinar today. And we're so excited that she could join us. A little bit about the relationship between the Arcora Foundation and the North Sound ACH. So Arcora and the ACH are partnering together to run the Local Impact Network for Oral Health, or the LIN. And this was started up just a few months ago as a way to move forward on the oral health goals of the region and make a difference in the health outcomes around oral health in alignment with the Medicaid Transformation Project. So we have many different partners at the table for the LIN, including North Sound Oral Health contracted partners, as well as other organizations that are not contracted partners with the ACH. And so the Arcora Foundation is a really key partner there, both in terms of providing resources and expertise. So we're really happy that we have that partnership. And one really exciting service that the Arcora Foundation provides is Dentistlink, which has come up a few times as something that partners are really interested in learning more about as an opportunity to connect their clients or patients with oral health care in the region. So that's what we're going to be learning about today. We will come back after Svea does her presentation, as I mentioned, for a Q&A, and then talk about other upcoming webinars that we will be doing as part of this weekly webinar series. So with that, I'd like to turn it over to Svea. So Svea, if you want to share your screen.
Great. All right, and my screen should be up. Heather, can you see that okay?
Yep, looks great.
All right, Great. So thank you, Heather. As Heather mentioned, my name is Svea Strami, and I'm thankful for you all to spend some time this morning to learn about Dentistlink and the services that we provide and how we can help tie into both the LIN and Sound ACH and provide connections to oral health care for the folks that you work with. Heather went a little bit over the agenda already, so I'll just be doing an overview of what Dentistlink is, talk through a couple different ways of how to connect to Dentistlink, and then give you a sense of what our service numbers are, so who we work with, how we work with them, and we do work across the state, so those numbers will be for that. Heather mentioned we are funded by Arcora Foundation, and Arcora is the foundation arm of Delta Dental, and we are fully funded by Arcora. And the vision that's shared actually by Arcora and Delta Dental is that all people enjoy good oral and overall health with no one left behind. And that's the key tenet to Dentistlink for us. That vision is precisely what Dentistlink is working for, that no matter who you are, what your situation is, and what your insurance is, that we can help connect you to oral and overall health. So what is Dentistlink? It is an easy-to-use tool that connects people across the state of Washington to dental care. And I'll talk a little bit more later about what those connections look like. So as I said, anyone can use Dentistlink. It doesn't matter what kind of insurance you have. If you have Apple Health, if you're uninsured, or if you have commercial insurance, users can use the website, call, text, or ask us to call them. It's a very simple tool, and we ask the smallest amount of information possible to get folks the referrals that they need. So it's very low barrier for them. Users get to decide how they want to connect with us, and you'll hear that as a theme throughout today. We really focus on the user experience, so they can make the decision about how they prefer to connect to Dentistlink. One of our biggest key attributes here is that we have an up-to-date database of providers. As is something I'm sure that many of you are familiar with, sometimes the list of Medicaid providers that is accessible to folks can be really out of date. So people can spend a lot of time trying to find a dentist who accepts Apple Health, calling different places to be told that they are no longer accepting. So one of the key things that Dentistlink does is in our database, we're constantly updating that information. So we hear back from clients, we're reaching out to providers, so we're continuously making sure that the information we have is right. So if we're giving someone a referral that needs a Medicaid provider, we know that that provider is accepting Medicaid at that time. And so that just really helps folks connect to a provider without having to spend a lot of time doing that work on their own and calling numerous different offices. The search on our website is made based on zip code and user need. And the reason I call that out is that it's basically provider neutral. So providers, once you're in our database, you come up based on the zip code and the user need. There's no sort of preference given to different providers. So it's a neutral search function. There's also, it's nimble and innovative. So we can respond quickly to the needs of both our users and our partners. We actually have someone in-house that can do our website work, do our database work, so we can just respond quickly to the needs that we see. We have 2 referral specialists on staff that people can connect to, and they are bilingual, and both are English and Spanish speaking, so we're able to provide those services. And if we need translation into any other languages, then we connect through LanguageLine. Our referral specialists are based in Washington, and they're extremely knowledgeable about the providers in Washington state, and they just have a lot of knowledge. So that's a very key value add for us, the knowledge that they have and that they're based here in Washington. If folks do call in, we can schedule directly with 5 FQHCs across the state. So for example, we're scheduling in Tacoma, in Georgetown, in Seattle, Belfair, and Woodland. So FQHCs all around our region. And if we do schedule for folks, we send text reminders for their appointments, which is a value add there for the FQHCs because that helps remind folks when they have to be there and keep that kind of at the forefront of their mind. We also provide patient coaching, which is a value add for our providers in our database. And we actually hear that pretty regularly, that folks that talk to our referral specialists show up ready for their appointments. They have the information that they need. And so we also offer that. And this is a theme throughout. So who do we serve? We serve everyone, any insurance type, anywhere in Washington State, and we serve them in the way that they choose. So I'm going to walk through the different ways now that folks can connect to Dentistlink. The first way is our self-service website. And so that is anybody can go to dentistlink.org, put in basic search criteria, and they'll get a list of dentists that match their needs. So that's just complete self-service. They don't talk to a referral specialist. They don't connect to anybody in person. They just go through and find the information that they need. And then the second main way people connect to us is through our referral specialists. There's actually 4 different ways that our referral specialists work with folks. And they just help to bridge care for users and providers. So they offer that kind of next level of service. Folks that might need a little more help navigating the system or want to make appointments directly with FQHCs. So the first way for that is that they can, if I'm using Dentistlink, I can call or text our referral specialist directly. We have an 888 number. The second is that if you go to our website, folks can actually put in that they want a referral specialist to call them. So they enter their basic contact information, and then our referral specialist calls or texts them back, depending on their preference. The third way is our partner referral page. So we have a dedicated page that's just for partners that we have relationships with, and they can go on and put in their client information directly on that page. That is, we have partner organizations that are mental health providers, emergency rooms, and a number of community-based organizations. Right now we have about 20 organizations across the state that use our partner referral page. And once they enter their client information, our referral specialists contact their clients. And then the fourth way is we have a number of medical care organizations that we are doing direct system integration with. So we're connecting with their electronic health record, could be Epic or whatever system that they use. And so folks can send referrals directly through their EHR to our Dentistlink referral specialists, and then we'll call them back. Right now, we have system integration with 6 hospitals across the state, and we actually just set up our first one and had our first one come through successfully from Snohomish County. So that was exciting. It was in Mill Creek, the Providence Mill Creek Medical Center there. So I wanted to show you just what the websites look like. Just grab some screenshots here. This is dentistlink.org, and as you see on the main page there, it asks whether you want to have a referral specialist contact you. So that's where they actually want us to give them a call. And the second is the self-service. You can just search the Medicaid dental providers in Washington State. And at the bottom there is our phone number if anybody wants to just directly text or call us. This page is an example of our partner page. These are the organizations that we have developed those relationships with. They'll go in through begin and then enter basic information. As I mentioned earlier, we ask the fewest pieces of information to get folks the care they need so that it decreases barriers to care. So really we're just asking name, date of birth, phone number, if they have insurance coverage, and then what their needs are. Then we ask how they prefer us to contact them. So those are the ways that folks connect to us. We are, just as a side note, we are in the process of revamping our Dentistlink website. So that's something that will be happening by the end of 2019. So we'll be adding a number of new features that we're really excited about. So these pages will actually look a little bit different in the upcoming months. This is a visual of how users can connect to Dentistlink. So you can see the 4 different ways, the web referral from our partners, our self-referral from users on our website, direct contact, which is the user calls or texts Dentistlink directly, and then our self-service there is in green. Once you connect to our referral specialists, this is the flow that you would go through. And I'd want to call out and highlight one piece here is that after a user talks to our referral specialist and we make that connection for them to a dental provider, we actually reach back out to them after 2 days and we send them a text and ask whether or not they were able to make an appointment. If they were able to make an appointment, they confirm with us that they have, we close their case, they're good to go. If for some reason they tell us that they were not able to make an appointment, that could be they didn't have times that worked for them, or perhaps they didn't want to travel to where that clinic was. We do find out why that is and then provide them with a new provider that they can reach out to make an appointment. So we have kind of that follow-up touch that happens to make sure folks are getting the information that they need and getting those appointments scheduled with the oral health providers. So I wanted to just share a little bit about who we're serving and how we're serving them across the state. So these are our statewide numbers. So far this year, up through about mid-August, we have touched 12,046 users through Dentistlink. You can see that a majority of our users do go through self-service. It's about 67% of the folks that we work with go through self-service. And then the rest are users who have connected with our referral specialists. In 2018, our total number of users was 13,660. And in August, we're already almost to that amount. So we've been seeing pretty significant growth as the years have gone by. This actually, 2019 is only our second full year of offering this program. 2018 was our first, and so we're in our second, and we're just seeing continuous growth as we reach out to new areas and new communities. I also want to highlight that out of this 12,000, we have 8,800 confirmed referrals made. So that means that we've heard back from people that they've made an appointment, that they've reached out to the provider to make the appointment, or on self-service that they confirmed that they received the referral and that they've made that connection. And so that's 73% of our users who confirm that they have a referral. So we're really proud of that number. And then I wanted to share for Sound ACH for your region what our Dentistlink numbers look like. And this is something actually we were pretty excited to pull out. We haven't focused on Sound yet. This is one of our first big communication pieces to your ACH. As Dentistlink has been rolling out, we focus on different areas. So we've had kind of this tiered approach. We're really excited to be starting to strengthen relationships and focus more on Sound now. So we were happy to see that we've already worked with 1,100 folks from Sound through August. You can see here that most of those have been through self-service. That's actually 75% self-service. And so as we strengthen relationships and start to develop referral partnerships with folks in Sound, we would expect to see more people coming through partner referrals, referral requests, and through EHR systems. We are actually going to have our outreach specialist for Dentistlink in Sound within a couple of weeks. So he'll be out there introducing himself, meeting partners, and starting to get folks more tied in to us as well. The only other piece that I wanted to mention is when folks call and talk to our referral specialists, we know that there are many barriers to accessing care. It's not just that you can't find a dental provider. It could be that you don't have transportation to get to the dentist. And so we do ask, our referral specialists do ask folks whether they need assistance with transportation, if they need assistance with childcare, and we're able then to tap into a directory that we're building of resources across the state to help connect them to community-based and also medically based resources. This is an emerging piece of work that we're developing. And we will be continuing to grow this to help, to go back to that vision piece that we want to connect folks to overall health as well as oral health. So we're also looking forward to rolling some more of that out. So those are the highlights of Dentistlink, how to connect to us, and look forward to working with more partners there in Sound. And I'll go ahead and pass this back over to Heather and answer any questions that folks have.
Great. Thank you so much, Svea. That was really wonderful. Okay, so as I mentioned before, please chat your questions into the Zoom chat box. You can see the yellow arrow on the screen. That's where you can find the chat box. You can chat it to everyone, or you can chat it to admin only. And we will answer your questions, and we've got a couple so far. So I will start with Amanda's question. So with the 12,000 referral users, I believe that was across the state, how are people mostly finding the Dentistlink site? Where is it advertised?
Yeah, that's a great question. So folks find us in a number of different ways. we actually do Google AdWords. So if somebody Googles Medicaid dentist, Dentistlink will come up as an option for them. So that's one way. And then one of our big ways of getting the word out actually is through our LIN and ACH partners across the state. So for example, in Spokane County, we've been working here since Dentistlink started. We have a number of different community partners who either hand out Dentistlink cards or actually refer folks into us through our website. So we have a couple of different avenues that way. And then also through our medical system partners. So we work with MCOs across the state and a couple other medical systems. So they find us in a number of different ways.
Great. Okay, thanks. So you mentioned, so there's different ways to connect, that staff at an organization could connect on behalf of a patient or a client, so like a case manager, a care coordinator. So could you walk us through that process a little bit more about what that would look like for a staff member to connect on behalf of a patient or a client?
Sure, yeah. So if we have a actual partner referral relationship, we do a little bit of back end work on that. So we have to have a data share agreement in place so that we're HIPAA compliant. And so whatever information that we're sharing back and forth, we're doing in the way that we need to do. So we would set up a data share agreement. And then once that's in place, we actually add the partner to our partner page. So when that person would go to our website, you would select the organization that you're from and then enter the client or the patient information on the form that we have there. So just enter their name, date of birth, phone number, and then also your information in case we need to follow up with you. So you just enter that information, hit submit, and then our referral specialists contact that client to connect them to care. Yeah.
Okay. Yeah, so I guess then follow-up question to that is, how can an organization become an official Dentistlink partner?
Yeah, so you would reach out to me, and I had my email up there, and then Heather, I know this will get sent out, but feel free to just include my email on that as well. And so we would look at the best way to make that connection. If you have an electronic health record system and you would want to do direct referrals that way, we can set that up. If you would want to go to our website and enter through our partner portal that way, we could do that. So it would just be finding out what makes the most sense for you, getting the necessary agreements signed, and then going from there.
Okay, great. So the partners or organizations would reach out to you, Svea, to start that process.
Correct. Mm-hmm.
Okay, great. So question, how is the partner page process different than direct referrals through an EHR?
It just goes through different systems. So for the partner page, you actually have to go to dentistlink.org. So you would go through the website to our partner page there and put in the information directly, versus in the EHR, when you're in your electronic health record system, you should be able to just find Dentistlink actually embedded in that system and do the referral that way. So it's the same information essentially that comes to us. You're just going through two different avenues. So some folks, don't have access to an EHR, so they want to use the partner page, and then, EHR integration might work better for others. So it's just different pathways to connect to us.
Okay, great. Next question, this is kind of a long one, but so the question is, how does Dentistlink stay current with the health centers and private practice offices that fluctuate their Medicaid access based on ever-changing capacity? For example, some offices will accept new patients for a while, then stop once they're booking out too far, and then open access again, or have exclusive access for select populations, such as pregnant patients, pediatrics, etc. So how does Dentistlink stay current with the changing landscape of who's accepting new Medicaid patients and who's not?
Yeah, that's a great question. It is a constant process. So we, in the database, we have basically flags for all of the populations that you mentioned. So if a provider is only accepting pregnant people, if they're only accepting people who have diabetes, if they're only accepting youth under the age of 6, we have all of that stored in that database. So when folks search, they only get providers that match their specific population. And our database is really easy to update. So that's one of the strengths, I think, of the system. And we have our referral specialists that are calling providers to update the information. We have an outreach specialist who is constantly contacting providers. So if we hear back that this provider is not accepting Medicaid right now, and they might be accepting again in 2 months, we mark them in our system that they are not accepting, so they wouldn't show up in any searches. And then we'd know to follow back up with them further down the line to see whether or not they've opened back up or not. So the database is constantly evolving, and we just do our best to really stay on top of it with the staff that we have, constantly updating and keeping that up to date.
Great, thanks. Okay, next question. Is there a feedback loop to the referring partner in addition to you reaching back out to the client?
So we have a couple of different reporting functions that we are able to do, and what we report back will depend on the needs of our partner, what kind of agreements we have in place, but we certainly have partners where we are communicating back that we were able to reach, say they refer 10 people to us, we were able to reach 5 people, we couldn't reach the other 5, and so we are constantly kind of communicating and closing that loop. I will tell you that right now, with full transparency, it's not perfect. That's part of one of the things that we're building out in our update. So at the end of this year, we're going to have a more robust reporting system. And so we're just in process right now of kind of building that out and showing what that's going to look like. So yes, we do, and it's going to get better.
Great, thanks. Okay. You mentioned that the referral specialists for Dentistlink are based in Washington. Is there anyone local in the North Sound region?
No, both are in Seattle right now. Yeah. Yeah, but both of them work with folks, they work with statewide, folks across the state. So they are knowledgeable from across the state.
Okay, great.
Yeah.
Okay, next question. We got a lot of good ones. In addition to following up with referral partners on whether or not a patient was referred, are they able to follow up with you about patient no-shows?
Yeah, so we do have, with one of the FQHCs that we're scheduling for, so this would be dependent on if we actually, know that that appointment was made and scheduled, so we can confirm that that's taken place. They do let us know whether or not they've had any patient no-shows. So it doesn't happen with all of our partners, but it does happen with one of the FQHCs that we're working with right now. And that was based on the decision that we made together about what we wanted that relationship to look like. So it is possible, it doesn't happen all the time, but it's something that we can do.
Okay, so that would be part of an agreement between you and the organization that you're partnering with.
Mm-hmm. Yeah, and again, that would be kind of contingent on that we know when that appointment was scheduled and where that appointment was scheduled.
Got it. Okay, great. So you mentioned that one of the referral specialists will be in the region in a few weeks. How can our organization connect with that person when he's here?
Yeah, so that's our outreach specialist, Carl George, and he will be up there. I think it's in about 2 weeks he'll be up there. So if folks are interested in talking with him, connecting with him, I would say at this point, go ahead and email, and I can coordinate with him to make those connections happen.
Okay, great. Sounds good. All right, and one more question, but feel free to keep chatting them in if you still have them, everyone listening. So does Dentistlink have the ability to connect patients with specific sites within a large health center organization with multiple sites? Yes.
So can you give me an example for that question?
Sure. So I guess an example like Providence, you mentioned that you were connected with, I think one of their Greek sites. So for a big organization like Providence is a large organization but has multiple sites in a region, are you able to connect patients directly to a specific site rather than to the organization as a whole?
Yeah. So we definitely can. So in the way that we make referrals, it is to a specific clinic. So it would be at the clinic level, not the organization level. So for example, the system integration we just did was with Providence Mill Creek Family Medicine. So they're referring into us now. And then, another example would be if there's a dental clinic at one location and not at another location, we would go to where that clinic is. So it is site specific, not organization specific. Is that
okay?
Yeah. Okay.
Okay. Well, that is the last question that I have here. But feel free if you have one more or if you have another one, chat it in before we end. Otherwise, you can always send more questions to us. You can contact the ACH staff at team@northsoundach.org. And our phone number is up there as well. If you want to give us a call, you're welcome to. I will also chat one more time, Svea Strami's email here. So if you want to connect, oops, that was just to admin. Now I will send it to everybody. If you want to connect with her directly to find out more about how your organization can become a partner or just send some follow-up questions, you definitely go for it. So thank you so much, Svea. That was really helpful.
Yeah, thank you. I appreciate the opportunity.
Absolutely. So before we wrap up, there's just a couple more things we wanted to talk about. So as I mentioned, this webinar is part of our weekly webinar series that we have been doing. And so on your screen, you will see a list of upcoming webinars. They are every Wednesday at 10 o'clock a.m. and they are always recorded. So if you're ever not able to join us live, you can always listen to it later. Coming up next week is a data webinar, and we will be talking about the All Payers Claims Database. September 4th, we'll be talking about Upstream, and you can see some of the other ones coming up on the list, including topics like HIPAA and data sharing, data sovereignty. In October, we'll be talking more about partner reporting for ACH partners, quality improvement, community information exchange, and more. So definitely keep checking in here, logging into these webinars as they're relevant and useful to you. And you will be sent, for everybody who's on the webinar today, we will email out slides and the recording. But you can also, as I mentioned, find those on the partner portal under resources and documents. Finally, we would love for you to complete a survey to help us evaluate this webinar and help us understand what is going well and what can be changed to be more effective. So you'll see a link on the screen, and Amanda just chatted that out as well. It's a SurveyMonkey. It's a really quick, easy little survey, just 4 questions. Any feedback you have is really helpful as we continue to provide these webinars to you all. So with that, I just want to say thank you so much for everyone for taking the time to join us today and ask all of those thoughtful questions. As I mentioned, if you have more questions, feel free to email the ACH team at team@northsoundach.org or connect with Svea directly at the Arcora Foundation. All right, thank you so much, Svea.